morning. I'm Roger Ebner. I'm the Director of the Office of Emergency Management for the City of Albuquerque. And thank you to everyone for being here today, and welcome to the Emergency Operations Center for the city. This is a facility where we can seat up to 100 people to manage or to coordinate the activities and responses to any hazard that we may face. It's important to note that it's designed not just for the city government, but as a central place or facility to coordinate with all of our partners across the city and beyond. So at this time, I want to introduce the Mayor of the City of Albuquerque, Mr. Tim Keller.
Okay, we have a number of announcements to go through. Also, we are aware of the public health order that came down from the Public Health Department, so we're going to touch on all of that. So I think just bear with us for an extended program. We also want to do questions and answers. If there's specific questions about specific departments, we're probably going to break up and have everyone available for that. So we'll take some in general, and then if we need to, we're all dedicated to informing the public pretty much all afternoon. So the folks behind me are all here for that, so we'll sort out after that. So let me begin with a couple of things. I know that for many folks in our community, the ongoing and international concerns with this virus have caused great anxiety and concern. And I know there's also frustration about the myths and about the theories that are going around out there. Part of what we're going to try and do today is address both of those, and both of those are very important, the sort of myth debunking, but also understanding these serious concerns. Now, first, I want everyone to know that our city has been preparing for coronavirus over the past several weeks. And we have been working with our hospitals and other government agencies, especially the county, which is also here with us today, in terms of what to do about this situation. Now, it's also important to remember that every member of the public also has a critical role to play in this, to make sure that Albuquerque contains and reduces the risks associated with coronavirus, especially those of us in public service. Now, the biggest key is this notion of social distancing. And I want to emphasize something that the entire world has learned as well as our country, that social distancing makes a difference. A 25% reduction in mixing with other people can create as much of a 50% reduction in infection. And I believe actually the graphs back here really speak to this, which if you want to talk about that after we can. This is what every country has seen. I also want to emphasize that it's really part of all of our role to understand that we might not know if we're carrying the virus. So for us to say, I feel good and I'm going to do blank, that is actually putting at risk, especially seniors. And so we're going to talk about how we're mitigating that. But it's very important for folks to realize you can't just think about yourself. You have to think about the seniors that you're interacting with and other vulnerable populations. Now, at the local level, we are also on the front lines of running our city. And we will continue operations as we normally would, especially with respect to public safety. And we want the public to know that as of right now, you can rely on city services just as you would before. Now, some of our city workers are in fact part of our first responders safety net, from the police to paramedics to sanitation to 911. Some of our city workers will have to work and continue to work regardless of what is going to happen with respect to this virus. It is part of our job as public servants to do that. Now, our leaders and workers are here to support the most vulnerable in our community. As a city, and our staff knows that we are in many ways the safety net for the most vulnerable parts of our community. That's often folks low income, that's often folks elderly and with other disabilities. This is where our city, in fact, actually has to step up for them in this time of need. So first, we're activating our Emergency Operations Center and our Joint Information Center to coordinate a joint response for Central New Mexico. That's what this facility does. We have the various levels of activation and so forth, and so that's why we're out here today. Also, our city is, of course, banning out-of-state travel for all employees. We're also readying telework policies for every employee that can. Again, I want to emphasize there are thousands of city workers where teleworking is just not an option. Things like sanitation actually have to go on to keep us safe from other infectious diseases and so forth that could happen. Now, we're also, with respect to the public health order that came out today, we are going through all the public events that are occurring that are greater than 100 individuals gathering. And we are identifying all of those which basically automatically are postponed. This involves events at the Chemo for the next 30 days, events at the South Broadway Center for the next 30 days, events at the Convention Center for the next 30 days that haven't already been addressed yesterday. This also means that based on the governor's order, events where folks are essentially transient, meaning they're moving through a space, those are okay. So our zoo, our museum, we're planning to keep those open at this time. This also is somewhat similar from a health perspective to something like Walmart or other businesses and shopping malls, which we know need to stay open and people need to continue going about their business. It's in some ways informally that sit-down, extended, close proximate exposure that we're really trying to limit at this time. We're also going to evaluate this every 3 days with a sort of rolling 3 days update in terms of what events might change. We've also been in touch, of course, with our Albuquerque or New Mexico United. They are postponing their first 2 games. Again, we'll see what the league does after. And we'll see what happens with other events similar to that. And of course, we'll be following suit with whatever the leagues and the national and regional schedules are doing. But for us, we're looking at this, what's going to happen in the next 30-day window and what, unfortunately, now is off the table. Now, I also want to mention that city workers and leaders, we are here to mobilize against support for the most vulnerable communities. And that does include some of the work that we're doing with City Council. Our council president is going to speak shortly about what they're doing, especially about the bill that we're going to need, unfortunately, to emphasize and implement some of the things that we're mentioning today. I also want everyone to know that our city has prepped and drilled for situations like this. One good thing that came out of the anthrax scare several years ago is that we regularly train for situations like this. And actually, it is a good thing in many ways, at least in Albuquerque. We do have the resources to be able to deal with challenges like this, and we regularly train for this. In fact, I believe in the last year we trained for an anthrax situation. So this is one good thing about having a city of our size and our resources, in a sense that we're as ready as we can be. We're as prepared as we can be, and we're putting those plans into action. I also want to urge the public, of course, to take the same precautions that everyone is now discussing. That means staying home if you're sick, avoiding unnecessary social interaction, large events, of course, washing your hands, coughing in your elbow. I also want to remind folks that to be very careful about discrimination. Discrimination is against the law and should be reported to our Albuquerque Office of Civil Rights. We have not heard any challenges around this in our city, but we know they are happening elsewhere in America, and we believe Burqueños will keep that one Albuquerque spirit and also be there to help each other and to check on each other and not fall victim to things like discrimination and scapegoating. There's stigma and xenophobia that can drive suspected cases underground, so that is also very important. This behavior can actually lead to people underreporting, and that makes us all worse off in terms of knowing how big the challenge is. It's also really obvious and important to say that the coronavirus does not discriminate at all. Race, ethnicity, or demographic or factors, and neither should we. Now, we also want to encourage folks, we want people to reasonably stock up on supplies, the key being reasonable. If we get into situations around hoarding and, buying certain types of things in complete disproportionate amounts, whether it's soap, food, and water, it's actually inappropriate, and it will be very counterproductive to our community. And I think most importantly, this is where we have to step up for our state. Pretty much everything goes through Albuquerque that then goes through rural communities. So if Albuquerque starts doing this, we're actually going to hurt rural communities first. So this is a way where you've just got to be reasonable in what you're thinking about in terms of a 2-week or a 30-day horizon. I also want to remind folks, I don't want to speak for entities like P&M, the New Mexico Gas Company, the Water Authority. We anticipate no problems related to any of those things. So that is one thing that is different than like a hurricane or a tornado. We do not foresee any infrastructural challenges. And so that's actually a good thing. People should have a little bit of a sigh of relief, especially around things like our water supply and so forth. Now, also, especially here in Albuquerque, we are no strangers to challenges. Our city has dealt with initiatives and situations like this before in terms of natural disasters, even going back to things like the hantavirus and so forth. We have a wonderful hospital. We have an amazing university health team, and we have a great emergency preparedness team in conjunction, of course, with our county. So we are ready, and we are putting those plans into action. Now, we're going to get into a few more details about this, and so I'm going to begin by introducing our Chief Administrative Officer, Sarita Nair. Sarita?
Thank you, everybody. I want to begin by acknowledging and thanking the folks right here at the Emergency Operations Center, including our Director of Emergency Management, Roger Ebner. You know, no one really wants to think about things like pandemics or earthquakes or fires until they happen, and Roger really makes us do that. And so we've had business continuity and operation plans in place for months and months now, not even knowing that this was on the horizon, and it's that type of preparedness that we want the public to be assured is happening at City Hall and has been happening for some time. So at this time, as the mayor mentioned, all city offices, programs, and services are operating, and we continually will update the public as this situation changes. We're activating this place. And then also, specifically for our employees, we have a ban on non-essential out-of-state travel for all employees. And we're encouraging employees to use teleconferencing and email to replace those face-to-face meetings. Employees who have been traveling are going to be reporting in to their supervisors and may be asked to self-quarantine. And we are giving paid leave to folks who run out of sick leave but are either displaying symptoms or self-quarantining for some other reason. You know, this just really highlights the importance of having a fair and equitable sick leave policy, and we have that in the city, and we're going to make sure that it operates to contain this disease. We're also prioritizing the continuity of critical public safety services, and our city's first responders are ready and prepared to lead the local response, and you'll hear directly from some of them shortly. And we're participating in a number of national networks of emergency providers and of other city officials, of other mayors, of other city managers. We want to make sure that we're getting the best of everyone's experience across the country. Also, we have a continuity plan for the 311 center, although the much better number to call is this one right behind me, but 311 will continue to function. As the mayor mentioned, there was an order that came out of the Department of Health, the New Mexico Department of Health, earlier today that puts a mass gathering ban on events of 100 or more that are in a single room or connected space in close proximity to one another. So there is that distinction between outdoor events and that sort of thing. And of course, you can look to the Department of Health and the governor's office to expand more on that, but we will have to follow that lead. It is effective statewide. And as the mayor mentioned, we want to recognize that this is going to be a difficult period for all of us. It's going to be hard on our first responders. It's going to be hard on our businesses. It's going to be hard on families. And we know that home is not always a safe place for everyone. It's going to be difficult for our nonprofits to meet the demand for their services, for immigrant communities to find resources in maybe their language of their country of origin. And it is because this and any kind of pandemic is tending to affect people who are most vulnerable, people experiencing poverty the strongest, that we know we have to find that balance between being the safety net that we know we are for everybody in the city and making sure that we're doing our part to flatten the curve of spread of coronavirus. So with that, I'll turn it over to our Chief Operating Officer, Lawrence Rael.
Good morning, everyone. Let me begin by also reiterating that we have been preparing for this for many weeks. We have had numerous meetings with all of our executive team and with our department heads to really begin to prepare the city for this eventuality. And so I'm here to tell all of you that our city offices will remain open, as the mayor said, and all the departments will continue to provide the services that we do as we operate on a day-to-day basis. However, there are some things that obviously will change and that we need to ensure that you all get the word out to the community as well. So all our city facilities, including the Sunport, the West Side Emergency Housing Center, all our senior centers, community centers, multi-generational centers, and public transit vehicles and facilities will go through an extensive periodic, if you will, sanitation and sterilization program to ensure that we are keeping those facilities as clean as possible as it relates to the fact that these facilities are always under a lot of constant if you will, trafficking from the citizens in the community. So, for example, our buses will be sterilized and cleaned every evening. We will do some periodic cleaning during the day. The airport facilities have already had additional staff in place to ensure that we're cleaning all of the public areas, all the touch points, so that we can ensure that those facilities are clean as much as possible. We also know that at some port, many of the airlines are already under a separate, if you will, order from the Federal Aviation Administration to continue to keep the airlines and the touch points in those, if you will, commercial airlines clean as well. So we're going to continue to do that. We know that this is, and I say to all of you, this is real-time management in City Hall. This is real-time changes that will occur, and we know that this is going to continue to evolve on a day-to-day basis, probably even on an hour-to-hour basis. So as we move through these programs or through these new decisions that are being made either at the governor's office or at the federal level, especially with facilities like the airport, we will continue to update and monitor those and give the public as much information as possible. Another important change for the airport is that we are encouraging people that are coming in to pick up citizens who are getting off a plane, et cetera, to use the passenger pickup lanes to avoid as much interaction as possible from having people get out and park their vehicles and walk into the facility. So we would encourage people to pick up their family members, their guests, whomever, at the pickup lanes so that we can avoid as much interaction in the facility as we can. That is we'll be monitoring that. We'll have additional security folks on the monitoring lanes to make sure that the traffic goes in and out as smoothly as possible, but that is a slight change as it relates to picking up passengers at the airport. Our aviation director, Ms. Nika Allen, is here, who will, if you have some questions specifically to that issue, that she can answer for you. We are also obviously looking at all the federal regulations that will be coming in as it relates to the Sunport, simply because it is the touch point for all of our travel throughout the country and for this area. So we know that at some point additional testing may be required, and we'll keep you all updated as we move through that process. As it relates to city facilities, there is a very interesting difference here. We have services that we provide on a day-to-day basis. Services that are obviously through our community centers, through our senior centers, through any of those facilities. But there is a slight change in that special programs where we have more than, as the mayor indicated to you, the governor's order, that programs that where we have more than 100 people gathering for events are obviously going to be delayed for the next 30 days or postponed for the next 30 days. And simply that is, for example, dances at senior centers where you may have more than 100 seniors in a facility, and those are very popular with a senior community. Those will be canceled for the next 30 days. Programs that are in our libraries that may be where we have a group of folks that will coming in to do studying on certain exhibits, et cetera, those will be canceled. So all of the programming, we will have a list of that information coming out from the respective departments over the next day or two to give you all a little more information about those, but those programs will be impacted. However, the facilities will be open, as the mayor indicated. You will be able to access certain aspects of the museums, of the zoo, of all the other public facilities that we have. Additionally, events at the convention center. The Albuquerque Convention Center is a city facility. It is also falls under the order of the governor. So moving forward, we will be making a determination on canceling any future events there for the next 30 days as we move forward to work under the order that was issued this morning. I would also say to you, as the mayor indicated, that the USL as a league, that's the league that the United soccer team plays under, is in the process of evaluating their season. We have been informed by the ownership of the United that they will be postponing at a minimum the first 2 games of the season for United. They will be getting information to us over the next, actually over the next 8 hours as to what their decision is as it relates to the rest of the season. And so, as we know right now, that United will not be playing their first 2 games until they make a final decision about the season as a whole. The PCL, which is the Pacific Coast League, which is the league that the Isotopes play under, they are also meeting today to evaluate whether or not any of the baseball season will be either postponed or delayed or maybe canceled in totality. At this point, We don't have any games in the next 15 days or so, but there may be the need to postpone additional games moving forward, again, as it relates to the executive order. Let me also say that as we move through this process, we will be giving people more and more updates on individual programs in the individual departments, as many are happening even today. Last piece is, look, as the mayor indicated, this is an important time for all of us to really work together. Let's just make sure that we extend to each other the common courtesy of realizing that we're all in this together, and that as one Albuquerque, we all need to help and support each other, especially with our most vulnerable population. So our Senior Affairs Department Director is here, Ms. Ana Sanchez. She will be able to give you a little more detail of what's happening in our senior centers, but it suffice to say that we are especially focused on ensuring that we have a clean and safe environment in all our community centers, as that population is very vulnerable. And additionally, our home programs, we will be considering taking additional meals to our seniors so that they have an additional meal at home, because many of our seniors are not able to get to the senior centers to eat. So we are ramping up those programs as well so that we can ensure that, that they have what they need as we go forward. So obviously there is a tremendous amount of coordination that has to happen with many of our city departments, as well as the relationships that we have with Bernalillo County and with other agencies throughout the city. So as we move to those, we will be providing updates to all of you as things change. And with that, Mayor, I'd like to turn it back to you.
Let's see who's next.
Matt. Ryan.
Okay, Ryan Mast, our Environmental Health Director.
Good morning, everyone. As the mayor indicated before, the Environmental Health Department for the city of Albuquerque has been monitoring the spread of the novel coronavirus for months, along with our state and federal partners. And over the past several weeks, we've been working across local agencies and departments to ensure that we're prepared for the possible arrival of confirmed cases to our city. Although the current confirmed cases appear to be connected to travel, it's important right now that we take those enhanced measures to help prevent the spread of the virus in our community. This includes washing your hands with soap frequently for at least 20 seconds, staying at home if you're sick, and covering your cough. These are very practical and actionable items that every citizen of Albuquerque can take that really does have a big impact in the continued spread of this illness. We also know that elderly residents and those with chronic medical conditions are disproportionately affected by this virus, and we really ask that such individuals reconsider travel at this time and limit their attendance at large public gatherings as an added precaution. If you believe that you're experiencing symptoms of this virus, please do not go straight to your doctor's office or hospital, as that may compromise those facilities. Also, unless it's a medical emergency, please do not call 911. Instead, we urge you to call the New Mexico Department of Health's hotline at 855-600-3453, which is also listed up here. For all your inquiries. There you'll have trained experts which can help you determine if there's medical attention that's necessary and also provide direction on next steps. We're also in constant contact with our partners at New Mexico Department of Health, who is the lead agency for this public health response, and we'll continue to share updates as the COO and the mayor indicated with guidance on our website about this virus, both from the Department of Health as well as the CDC. At this time, it's really critical that we all consider what those thoughtful actions are and make sure that we are looking out for those in our community who are most vulnerable to this virus. Together, we can reduce the risk of illness here in Albuquerque. As an added measure, you'll start to see additional signage and guidance up that's posted at city facilities just to help people think about some of those measures that they should be taking. So we'll start to see signs such as this, just to kind of stop and think before you enter this facility. If you are experiencing some of those illness or those symptoms of the virus, please reconsider entering that and call the hotline to get additional guidance. So thank you for your time, and at this time I'd like to welcome Bernalillo County Manager Julie Baca.
Good morning, everybody, and thank you for the opportunity to address this very important issue. First of all, just to avoid any confusion, I want to make it really, really clear we are working together. So we're following the governor's executive order, and everything basically that Lawrence and Sarita and the mayor shared with you, we are totally on board with. So I just want to make everyone understand that we're working with the state, with the city, with schools, a university, university hospital, other nonprofits, and there's also people, Nusenda Credit Union reached out to us. How can we help? Just this morning. So everyone is very, very interested in assisting and working together. So at this time, we're just urging calm concern with regard to the coronavirus and the single confirmed case in the county at this time. So we've taken the initial step, Bernalillo County, in activating the infectious response team. So the team is now assessing the coronavirus threat on a daily basis, and decisions of this team will govern how the county moves forward with the city with regard to the possible spread of the coronavirus. So the infectious response team has taken 3 steps. First, training sessions and employee travel plans, as addressed by the city, have been canceled for the foreseeable future. We are instituting increased cleansing and sanitizing of public facilities. And while facilities will remain open for public use and access, we are identifying essential personnel in the event services need to be curtailed. So it's very important to note you will always have access to fire, rescue, and law enforcement. We've got your back. So I'm urging everyone to be diligent of your health and the actions around you. We're taking this very seriously, and just be assured that we're here for you. We're here for the public, and that we're doing our very best to protect all of you, to keep you informed, and to keep you safe. So just if you could please follow the outlined CDC guidelines. And again, I just want you to remind you that the county is monitoring the situation along with the city, along with APS, along with UNM, UNMH, all our partners, and taking a calm, concern approach. So let's do our best. Let's do our part to protect ourselves and to protect each other. And know, like Lawrence said, we're all in this together. So this has no boundaries, and neither should we. And I just want to let you know that we have our fire chief, Chief Greg Pettis is here, and our emergency operations manager, Richard Clark, is here as well from the county to answer questions. And I thank you very much.
Thanks. And next, City Council President Pat Davis.
Thank you, Mayor, and thank you to everybody for being here and for helping us with this. I think on behalf of the City Council and the rest of the city, we just want to echo and appreciate how much it's great to have a team that we know we've worked with for a long time and has been working on these issues. As Sarita said, sometimes the behind-the-scenes planning is not stuff we see a lot of, but for those of us who get a chance to see some of it, it's important to know it's there and know how quickly we can put it in place. It's important for everybody to communicate, and we're asking our media partners to do this with us, to remind everybody that these provisions are about preparedness and not panic. We're working hard, as you can hear, to ensure the government continues to operate, providing our services. We're tweaking those services to make them more responsive to the emerging needs and the changes. And to that end, as some of you have seen yesterday in our news announcement, the City Council will consider on Monday new legislation that creates new emergency powers for public health emergencies, giving the mayor the authority to reallocate city staff and city resources where they are needed most without having to come back to the City Council for individual budget appropriation authorization, for example. It also allows the mayor to copy many of the same public health provisions that the state Secretary of Health has for city facilities and businesses here in the city in the most extreme circumstances. We're leading by example at the City Council as well. We've limited our outside travel. We've limited public meetings. And beginning with our City Council meeting on Monday, Commission Chair Lonnie Talbot and I spoke this morning, and I know the county will have some more information about this, but we're going to move forward collectively to limit the ability of in-person public comment and participation in those public meetings, and we'll be rolling out protocols for folks to continue to communicate with us by email, by phone, and by other provisions so that people can continue to participate, but so that we also respect the need for city employees to be able to use our city facilities to do their job without the disruption of a potential contamination. And so with that, we continue to appreciate everybody's help and consideration. You'll get a notice from our neighborhood office this afternoon to neighborhood associations recommending that they not have their neighborhood meetings. And we're going to provide tools to boards and commissions and neighborhoods who feel like they need to have those meetings by conference call or digital tools, so that we can continue to let those folks have that ability to do so without unnecessarily affecting and impacting those who might be most at risk. And so again, we appreciate very much our partnership with the state and the county and the mayor, and we stand ready to support. Thank you, Mayor.
All right, let's see here. I believe there's a doctor in the house. Dr. Bauer? Here. All right, come on up.
Thank you. I'm not that kind of doctor, sorry. So I'm Chris Muir. I'm the Executive Director for the Student Family Community Supports Division with Albuquerque Public Schools, and I want to take this opportunity to thank all that are here and putting this together so that we can let you all know that we are working together. We're working very closely with the city, the county, the State Department of Health, the State Department of Public Education as we all tackle this pandemic. APS does have a pandemic plan. We've had it since 2009, and we pulled it back out again, and we've readjusted it to make sure that it meets the current situations that are going on with coronavirus. And we have activated our pandemic team at the district level. So we have been working together now for about 2.5 months, the team, to come up with how we will respond as a district to the pandemic. One of the things that we look at very closely in education is prevention. And so we have really activated our prevention, everything that you've heard about coughing into your sleeve, making sure that hand washing 20 seconds. If you don't know how to do that, say the ABCs or happy birthday slowly while you're washing your hands. 20 seconds actually is longer than you think it is. And so we not only tell all of our staff, but we have them teach the students how to do that. This is something we should have been doing all along, but now we're doing it again. As reminders, we've put up posters in all of our schools, at our administrative offices, talking about the things that you can do to help prevent the spread of any kind of virus or other contaminations. We've upped our cleaning in our schools, and so especially in high-touch areas, things like doorknobs, surfaces, those kinds of things are cleaned on a daily basis, and more often if needed in our schools. So we've increased the cleaning, we've done all of those things. We're now also looking at, we have worked in the past with the Emergency Operations Center. We're continuing our relationship with that. If we do end up with a crisis in the city, that we will be prepared for that. At this point in time, schools are not being closed in Albuquerque Public Schools. We are getting ready for spring break, which is really a good thing, so schools will be closed in another week. This week, students are not in schools due to parent-teacher conferences, and so we're, where we can, we're doing more cleaning again this week. We take our direction specifically from the Department of Health in New Mexico, and we work very closely with the city and the Public Education Department if and when. Some of the reasons why we're not closing schools is that it is not quite at that point yet where we're worried about students. We do tell students and parents that keep your kids home if they're sick. We have changed our policy that right now the current attendance policy is after 3 days you have to have a doctor's note. You don't have to have that anymore, and all home illnesses, keeping kids home, is considered an excused absence. And so we don't have to, parents don't have to go that extra step because we're trying to keep them from having to take their kids to the doctor. As you heard from some of the other speakers, that's not necessarily the best way to go to emergency room or to the doctor. We're putting out the 800 number continually. We're sending updates to our schools and families on a daily basis now. And one of the things that will be a big consideration that we're working through right now is feeding children. If we do end up having to close schools, we have a very large number of students in Albuquerque Public Schools that are on free and or reduced lunch, and many of them, that is their meals for the day, and also get fed in out of school time. And so we're working through that and figuring out how we might distribute food if we do end up closing schools, how that will happen. We know that we're going to need the help of the city and the county in order to make that happen. And so we're working through all of those things. We are very thankful, again, for the partnerships that we've already had in place and that we are able to then rely on with the city, the county, the Department of Health, the Public Education Department, because we are all in this together, and we will have to make joint decisions as we move forward. And we are also looking at how do we limit those high access things that are happening where we have 100 or more people in the room. We're canceling things. We've already canceled out of state travel for all employees in APS until further notice. So we're doing the same types of precautions that you're hearing from all of the other speakers today. So thank you for having us here, and thank you, Mayor Keller.
Well, thank you so much, APS as well, for being here today. And I know as an APS parent, I'm grateful for what you guys are doing. And we teleconferenced into our parent conference this morning. So it was a good example of what we got to do in this time. Next, we do want to hear from another doctor, a medical doctor this time, I believe. Dr. David Pitchers is here from UNMH, and he is the Associate Dean of Clinical Affairs. Doctor.
Good morning. I just wanted to provide everyone with the reassurance that University Hospital and all of the UNM clinical components have been preparing for an event like this for well over 10 years. We are well adept at emergency management procedures in managing any type of healthcare catastrophe that may hit a community. This is no different in that we are well prepared. We opened up our Emergency Operations Center last week, and we had been monitoring and running an incident management team for the past 2 months, monitoring the evolving situation with coronavirus. We've already taken the necessary steps to implement appropriate procedures for managing any potential surge in patient demands and needs, and we've also taken all the appropriate measures to work with our other community health care providers, the greater community, Department of Health, and all agencies that are involved in responding and protecting our community from these kinds of events. We have also taken steps to assure that our critical clinical operations will continue, and they are continuing. So the healthcare needs of our community will continue to be met while we also meet the challenges presented by a pandemic situation. And with that, Mr. Mayor, thank you.
Okay, I think what we're going to do, we do have folks from law enforcement here, but I think we're going to transition to Q&A. I'm just making sure that's our next step, but if folks do need to hear directly from public safety and law enforcement, they're here for your questions. A couple of other items to mention. Number one, we are asking the federal government for either resources or kits. Albuquerque and UNMH is in a position, again, because of our drilling and training on this, where we can test a whole lot more folks a whole lot faster. That's a good thing for our community, but we need help to do that in the form of one of those two things. So we'll be in touch with our federal delegation shortly on that, as well as the relevant federal offices. Now, that capability, again, is a reflection of us being Level 1 Trauma Center, of us being the urban core for roughly 1,000 square miles in the high desert. So I also want to talk a little bit about our homeless shelter and what's happening with the homeless community. Sarita, do you want to go into that?
Thank you. So the shelter is open. It is operating. It has always been our practice to leave it open 24/7 whenever APS is not in session. So as APS thinks through its decisions, we'll be thinking through that side of it as well. We are screening everyone as they come into the shelter, and making sure that we're not exposing people and we have the ability to isolate anybody who would display symptoms or test positive. That hasn't come up yet, but we have that capability and that preparedness. I think this also just really highlights why we need a shelter in the town and why we need a gateway center that is sort of a focal point for our service providers, because right now we have the added complexity of busing folks 20 miles back and forth, and that's just adding a whole layer of complexity and time to what could be a way more straightforward process if we had that shelter in town in close proximity to other services. So the public has already spoken, they understand the need for this, but this is just another example of why we do need that urgently.
Okay, thank you so much. Now, let me basically just close by reminding folks we do need everyone to be a good neighbor, especially if you happen to have elderly folks living nearby, folks that you know might have a particular disability that limits them to access to resources or information. Check on them. You know, help out with a meal. Things of that are actually a great way to help out our community and step up. Now, let me also just mention that we're going to have a rolling 3-day update with respect to events. So stay tuned if there are specific event questions. Departments are going to be going through all of that over the next few days. And we'll continue to basically revise that as more and more information comes to light. And also as we get further down the 30-day calendar. So with that, we will be here for your questions.